what's going to happen?
Well, this is a good question. So
Yeah.
I think at this point is like what's probably going to happen because given, so, like we have seasonal flu, right? So the reason we have like more flu, there's a flu season. And the reason there's a flu season is because like winter, when you actually have low humidity and lower temperatures, the transmission is better. And then people are hoping, there are a lot of people are hoping that, okay, maybe this virus is also the same. Other coronaviruses that are kind of cold type coronaviruses, they actually are also seasonal. So there's like a fraction of the cold viruses are actually other types of coronaviruses. They're very, very distant to the SARS-CoV-2, but they're also coronaviruses and they're seasonally driven. So people are hoping that, okay, maybe once it becomes warm, when we hit the summer, then this is just going to automatically disappear because the transmission is going to be bad. It's going to go extinct by itself, and that's probably going to happen. But what we're seeing in Australia seems, and New Zealand, which are having their summer now, and it's getting transmitted anyways, seems to suggest that, okay, maybe this will be here for good. It's like, and then eventually when you have 60 to 70% of the human population infected, and then the infected people, when they recover, they have like an immune memory. Basically, like, for example, if you have, many diseases that you have it once, you will have it only once, and you
Chicken
never
pox type of thing.
Yeah, exactly, like chicken pox or measles. Once you have it once, you never have it again. And then you have immunological memory, and then it's like you can never be infected. So then it's going to become a disease of childhood. So basically, you're going to have, once enough children are born that have never seen this virus, this will be able to transmit in bouts related to the population, become big enough to be transmitted and maintain the transmission. So you're going to have epidemics periodically every few years or something like that.
But what about the cases of people getting the disease twice?
So that's not clear yet. So there are reports of that, and there are quite a few reports of that. So I don't know whether that's a problem in the testing. So the testing is not perfect. So let's say you got tested and then you show a bunch of times as negative, and then it comes back. But what is most worrying is a couple cases in Chinese healthcare workers, because they're monitored really well. And they also know more or less when they got sick and which events they got sick, because they it says, okay, this time I didn't put my mask on right, or like, this time I actually touched the patient. And so they can actually have a pretty good guess of when they got infected. So they can know they were tested a lot also. So it disappeared for a while and it came back like weeks after. So it's either they got infected again or they never got cleared out completely. So basically that could be like, you cannot distinguish those things very easily, whether basically you had like a low amount of virus that you couldn't detect and eventually came back.